So this is video 6-133, bimanual thumb digits, metacarpal, anterior to posterior, or posterior to anterior glide. So patient is going to be seated with arm and slight forward flexion. The doctor is going to be standing standing in front of the patient over the affected side, and the segmental contact point is going to be the metacarpals. On this one, I'm going to do 2 through 5. But for demonstration for the video, I'm just going to do the second metacarpal. So on this thumb's contact point is going to be thumb contact on the metacarpal that I want to feel. So in this case, my inside hand is going to contact the first, or I guess the second digit, and then the second, and then my outside hand is going to contact the third digit. Or third metacarpal. So I'm going to come in with fingers on the other side, contacting the same metacarpal. So inside finger is going to contact the second, and then outside finger is going to contact the third. I'm going to shear anterior to posterior, posterior to anterior. While I'm doing this for the first one, I'm going to stabilize my third digit while moving the second. So I'm going posterior to anterior, anterior to posterior. I feel loss of springing motion going posterior, so anterior to posterior. I'm going to spring posterior on the metacarpal bone. Then I'm going to come in on the second one, on the third bone, and then I'm going to do the same thing. So I'm going to stabilize the second digit while springing anterior to posterior, posterior to anterior, assessing for springing motion. I feel loss of springing motion going posterior, or going anterior. So I'm going to spring anterior, come back, reassess, joint motion has been restored. And vector for that is anterior, posterior, posterior to anterior.